pause of this video and look at the case scenario once. Let's decode the case scenario now. The main clinical features in this case is it's a 4-month-old baby where the condition is said to be acute, which is for 3 days, and there is no sucking or feeding, as the mother says, and also there is in poor head control, which means a hypotonia. So this diverse case to the neurological deficit, something related to CNS, and also the baby is having an weak cry, which is due to a dehydration condition, and also you can see that the temperature is 99 degrees Fahrenheit, which means that there is mild infection, and the CSF finding is unremarkable. So let's decode now. So all these conditions may turn the case towards a meningitis or sepsis, but in meningitis or sepsis, the temperature should be above 100 and also the CSF findings will be there. But here there is no CSF findings and the temperature is less than 100, so meningitis and sepsis is ruled out. So we have to think apart from the sepsis condition or the meningitis, that is a inflammatory condition, whether it can be an myasthenia gravis, infant myasthenia gravis. But in the clinical feature in infant myasthenia gravis is there will be a fluctuating muscle weakness, but here is a steady muscle weakness where the baby is not feeding for continuously for 3 days. So that is also ruled out. Next is GBS, that is a Guillain-Barré syndrome. But in Guillain-Barré syndrome, it should be an ascending paralysis, and here there is no anything related to ascending or descending paralysis in this condition. So even the GBS is ruled out. And some metabolic disorders can also be mimicked like this, but in this case scenario there is no mention about the metabolic acidosis or metabolic alkalosis in this condition, so even that is ruled out. So considering all these features, the one clinical feature which is most prominent is we have to think about is, one, the temperature is 99 degrees Fahrenheit, which is there is a mild infection plus there is a muscle weakness. So something related to the presynaptic neuromuscular junction involvement. So that can be due to infant botulism, which is due to Clostridium botulinum spores, which releases neurotoxin and which it will be affecting the acetylcholine receptors, which can lead to all these clinical features, whatever it is said in the case scenario. So this case is a typical case of infant botulism.